All right, I see folks starting to join us. And as we get started, I'm going to start a brief video that just will welcome folks in the space as people are joining us. And then we will get the show on the road in just a few minutes.
Thank you for joining us today. While we're waiting for folks to join, we'd like to share a little bit about our work.
The National Alliance to End Homelessness is a nonpartisan organization committed to preventing and ending homelessness in the United States.
We build knowledge using research and data to discover what works to end homelessness, and then we develop easily accessible knowledge about these solutions.
Based upon this knowledge, we improve policy through educating opinion leaders and policymakers about what works and try to build strong policy in support of solutions.
We help communities implement those solutions through our Center for Capacity Building, which includes our Center for Learning, providing training, technical assistance, and tools to providers and public agencies.
We bring the field together: policymakers, researchers, practitioners, philanthropy, and advocates to address key issues in the effort to prevent and end homelessness.
Thank you on behalf of the Center for Capacity Building for joining us today. We'll get started in just a moment.
Learn more about our services at endhomelessness.org and look for training at the top of our site. Or email us at thecenter@naeh.org. And thank you again for joining us today.
So, just to keep us going, there's still folks joining, but I'm going to get us started. You are here. Welcome to the Stronger Together series. Many of you probably have joined us for some of the earlier sessions in the series, and today we're here to talk about rapid rehousing, which is a proven approach to ending homelessness. My name is Deve. I am a senior technical assistance specialist at the National Alliance to End Homelessness. And I will be taking us through some housekeeping at the top of the session today, and then introducing y'all to our amazing panelists. Just to start off, you heard a little bit on the video about who we are and what we do. We are the National Alliance to End Homelessness. I'm part of the capacity building team, helping communities implement effective solutions to ending homelessness across the country. And at the Alliance, we try to make sure that any conversation that we're hosting, any place that we're bringing folks together from across the field, we hope that it's an inclusive space. And in order to do that, we have some just basic ways of engaging to make sure that people feel respected and included and are able to show up with all of their identities. And so I wanted to kind of go through that, just make sure people understand that in the chat today, as we're interacting, we ask that you engage respectfully. We want this to be a place where people can share their thoughts and be open and be learning. And that means we have to also be curating a culture of respect for everyone here. So if you experience anything in the chat that you're uncomfortable with, please do let myself or anyone else from the Alliance know. And we will be monitoring the chat for any kind of abusive or harassing language. And we might remove you from the session if you engage in that kind of behavior. If you have been at one of these sessions before, this may be familiar, but there are a couple of ways that you can interact today. There's the chat, which is for y'all. I see you all introducing yourself, letting us know where you're coming from. It's very exciting to see folks from everywhere across the country. So please do use the chat to interact with each other. If you would like to pose a question to the panelists, I'll ask that you do that in the Q&A. Because the chat goes so fast, we may not catch it if you just put it in the chat. So please do use the question and answer box if you'd like to get your question answered. And this question always comes up, usually multiple times. We are recording the webinar. It will be available after the session today. You'll get it in your email if you were registered, and anyone will be able to access it on our website. That should be posted early next week. So don't worry, you don't have to take notes. The webinar recording and the slides will be available after the session. Couple other things. If you are using closed captioning, they have been enabled, but you may have to address in your settings if you're not seeing them on your screen. So if you're having any issues with that, you can chat at us, but oftentimes it's in the settings on your own computer. If you have not yet joined us for any of the other sessions in the series, I'll just give you a brief overview of why we're here and what we're doing. So this is a series where we're going through each of the components, each of the key components of an effective homeless response system. And we're doing that in part because we're hearing from y'all that there's been a lot of turnover in the field. There's been a lot of changes over the past few years. And there felt like there was a need to get back to basics. And so we wanted to do that, but we wanted to do it in a way that was kind of reconnecting the pieces of the puzzle and not just standalone interventions. Because we know we have to work together to end homelessness. It's not one intervention that's going to do it. People have a diversity of needs. People are at different stages of a crisis. And so we really do all need to be working together. So if you have not yet checked out the other sessions, this is actually the 6th in the series. The one last month was about emergency shelter. Before that, coordinated entry. All the way back in January, we were talking about street outreach. So I encourage you to go check out those recordings and those materials. There's a lot of great information, a lot of really inspiring stories from across the country from panelists, and we're going to keep that going today. So just a little bit about what we mean when we say a homeless response system. Here at the Alliance, we understand that if we have the goal to end homelessness, we need a system that's working effectively, efficiently, and equitably to do that. And that means diverting people from homelessness whenever possible, right? If someone does not have to fall into our system and experience homelessness at all, if there are other solutions, we need to be finding them and using them. And we need to house people as quickly as possible out of our systems. In order to do that, we want to make sure that homelessness is a rare, brief, and one-time experience. So when people do become homeless, we need to make sure that they're not unsheltered in our communities. That means ensuring there's a crisis resource available, immediate help, a safe place to stay while they're figuring out their next step. We want to make sure people are not spending long periods of time homeless, whether that is in unsheltered locations or in shelter programs or interim housing programs. And we also want to make sure that people who do exit homelessness are stabilizing in their new housing and not cycling back in to our systems and falling back into homelessness. So to understand how to make a system do that, there are some measures that we use to understand how well we're doing at this goal of ending homelessness. We want to reduce inflow into our systems. We want to reduce first-time homelessness. We want to problem solve with people before they become homeless and divert people whenever possible, prevent homelessness and divert people whenever possible. We want to increase exits from all of our programs across the system into permanent housing. We want to decrease the average length of time that people in our system are spending homeless. And we want to decrease returns back into homelessness from any of our programs and from folks who have found permanent housing. To do that, there are all these different interventions and all these different parts of a system. And we are now, like I said, at the 6th one in our series. There are a couple more coming up after this, so stay tuned in future months. But we also know that these interventions don't work separately. They have to be working all together, and they have to be sharing approaches that are effective. And so we know that systems that are housing first, that use their data to understand how to address the local context of their crisis, that are paying attention to equity and whether or not their outcomes are having disparate results for different people, different races, different genders, different family compositions of people, and systems that are coordinated and working together. Those are the systems that are moving the needle towards ending homelessness in their communities. So in order to have a system that is coordinated, we have to kind of understand how it all flows together, how it all works together. So we use the metaphor sometimes of a traffic circle, or a rotary, or there are a lot of different names for it in different parts of the country that I'm not coming up with right now. But if you ever entered a traffic circle and had someone kind of not know the rules of the road and kind of stop traffic in the circle and stop the flow, it can cause a lot of problems for everyone coming in, going out, and going around. And so it's really similar in our systems. If one intervention, if one program is not functioning in flow with the rest of the system, it can really cause problems for the whole system. And so we're going to talk about rapid rehousing, but we're talking about it in the context of a larger system that has to all be working together, and all working towards the end goal of ending homelessness. So we have a lot of programs in every community, and sometimes they're great programs, but they're not all in lockstep together, and they're not all flowing together, and we can end up with a bit of a pile up in our system and people getting stuck in our system. And what we want and what we hope for is that with a little bit of planning, a little bit of coordination, our systems can work more to kind of flow people through, get people where they're going, and not have people kind of stuck in limbo along the way, because that means being stuck in homelessness, which is not what we want for anyone in our systems. So with that said, with all the changes in recent years and the rising numbers of households falling into homelessness across the country, it is more important than ever that our systems are making the most efficient use of our resources to house people quickly and to help them stabilize. And rapid rehousing is a program that has the capacity to do that in most communities. And we know that rapid rehousing programs are facing real challenges with changing funding landscapes, with COVID dollars coming to an end, with housing markets getting tougher, vacancy rates going down, rents going up, and also with our own systems kind of having limited resources. And we know that the average rapid rehousing client today, or rapid rehousing household today, may have higher service needs than when the program first emerged. So we know there are challenges, but at its core, rapid rehousing is a flexible and adaptable intervention. And that's one of its central strengths as a tool for ending homelessness. So we've pulled together a bunch of communities who are finding really creative ways of making this flexible intervention work to transition people out of homelessness. And they are seeing it work, right? The majority of households exiting rapid rehousing programs are exiting to permanent housing. And the majority of households are not returning, even though they face continued challenges. So in this conversation, we're going to hear from 4 of those communities. And I'm going to turn it over to our moderator, Amber Freeman. She's the Director of Training, Technical Assistance, and Community Impact at the Connecticut Coalition to End Homelessness. The Connecticut Coalition is committed to solving homelessness through policy and advocacy, community building, training and technical assistance, and emergency assistance. The Connecticut Coalition leads the statewide initiative to end homelessness called Connecticut Can End Homelessness. And Amber currently oversees all of the programming at CCEH, from system-wide to population-specific. And her focus is on addressing the challenges and barriers that stand in the way of progress towards ending homelessness and building the capacity of the housing and homelessness service system by providing training and technical assistance and working with partners and communities from homeless service providers to state and local government entities. Amber has over 20 years of experience leading teams in mental health, skill building, case management, and homeless services sector. She is a 2-time graduate from Hampton University with a bachelor's degree in psychology, education, and a master's degree in community agency counseling. Amber, please take it away.
All right, thank you so much, Dave. Hello, everyone. As she said, I am Amber Freeman. I am the Director of Training, Technical Assistance to Community Impact at CCH in Connecticut. And I'm really looking forward to moderating this discussion today, this really important discussion. Before we get into it, I'm just going to provide, yes, I see HU in the chat. I'm just going to provide some context around rapid rehousing so we all are on the same page as far as what we're talking about. So rapid rehousing is really an evidence-based approach to end homelessness as quickly as possible for families and individuals. There's three main components to rapid rehousing. The first one is housing identification, and that is helping to find suitable housing, negotiating with landlords. The second component is rent and move-in assistance. That's the financial assistance, the flexible funding that we can use to really be able to meet the needs of each household. And then lastly, the case management services, right? Because we don't just want to house someone, but also provide them with services and case management. So individualized support. It may be helping with employment, education, life skills, linking to resources and so forth. So as Deep said, we know that there are a lot of barriers and challenges right now with limited housing stocks or landlords not wanting to rent to someone that has a housing subsidy. So there's tons of challenges, there's tons of barriers, but you all are going to hear from individuals that have some great rapid rehousing programs and will be able to provide you with hopefully some skills and some tools that you can add to your toolkit. So right now I'm going to ask the panelists to come off of mute and put your cameras on and introduce yourselves. Let's start with Melissa.
Hi, everyone. Melissa Humbert Washington. I am the Vice President of Programs and Services at Home for Families in Columbus, Ohio. We do rapid rehousing and homelessness prevention services for mostly families with minor children, pregnant and birthing people, and transition age youth, so 18 to 24-year-olds. We also have a couple of pretty cutting edge programs that we call our Bridges programs, where we're working with people who are either trying to get a college degree in our local community college or trying to go through some kind of a vocational training program so we can support their housing during that time as well. We really believe in housing intervention services and that housing is a human right, and we try to always lead with that before we do anything else.
Great. Jimmy Yu.
Jimmy Yu Evans here in Atlanta, Georgia. I am the co-CEO of Project Community Connections. We are a rapid rehousing provider here in the Metro. We've been around for 25 years doing permanent housing placement, but now called rapid rehousing across the nation. So excited to be in company with such great leaders on this panel, and glad to see so many familiar names that have joined us today.
Thank you. Amber.
Hey, good afternoon, everybody. My name is Amber Austin. I'm located in Dallas, Texas. I am the Senior Manager of the Coordinated Access System at Housing Forward, which is the lead agency of the Dallas and Collin Counties Continuum of Care. And just for context, for folks listening, our community does have traditional rapid rehousing programs, but a lot of what I'll be sharing about today is how our community is creatively using rapid rehousing funds for diversion and rapid exit. So I'm also looking forward to the conversation.
Great, looking forward to it. And Liz.
Hi, good afternoon. My name is Liz Hitt, and I am the Executive Director for the Homeless and Travelers Aid Society here in Albany, New York. We're about 3 hours north of New York City. And we operate several programs: rapid rehousing, permanent supported housing, coordinated entry. We have a team of 4 people that work within the Capital District Psychiatric Center. We have a furniture bank and lots of other things, but so excited to be talking about rapid rehousing here today. We are very passionate about rapid rehousing, and we've been working with that program since about 2009 when it first came on board through HPRP. So glad to be here. Thank you.
Right. All right, and just to start us off, I know you all have different rapid rehousing programs, but can you tell me what are your leading principles and or practices of your rapid rehousing program? What really guides you all and leads you?
I would say that probably the most important thing for us is individualizing all of our services. So each client that we work with is in charge of their own plan. They're in charge of telling us what they want and don't want. Everything operates under their time schedules, under the goals that they want to accomplish and when. We do not have a cookie cutter approach for different people. Developing rapport and relationships and trust, and then trying to figure out what the client wants for their family is definitely the most important thing first.
So I would say we have two different rapid rehousing programs. One is designed for people coming home from a New York State prison. Those beds are specifically set aside for that population, and that's been really very successful, making sure that people have a place of their own when they come home is very important to their stability and to everyone involved in their care. And then we have a rapid rehousing program that serves a lot of people that are unsheltered, chronically homeless, struggling with an active addiction. But all of those programs are housing first, based on housing first principles. And as Melissa just shared, really all about that individual, and whether it's rapid rehousing or PSH or anything else, that's what works. That's certainly what we have found, that nothing can be done for every person, that you really have to meet people where they are and see what their individual needs are. Thank you.
Yeah, and I'm so glad that you mentioned housing first, as it is a leading principle for rapid rehousing. Jimmy, you have anything to add?
No, I think that, the rapport building is definitely a part of our programming, mainly because we try to ensure that we set up a long-term standing relationship with the individuals we're working with from the very beginning, and have a clear understanding that this is a partnership. And we try to make sure that we use that language a lot at the onset of that initial assessment about partnership. So there is a sharing of responsibilities around those core components that you mentioned. The other thing that I didn't hear that in the technical terms would be progressive engagement. So using progressive engagement to ensure that we're setting people up for the best success in this rapid rehousing partnership, that we're not giving them more than assistance than they need. We're giving the right amount, and it is individualized, as Melissa said.
Right.
Amber, I think I would just echo some of what Melissa and Jimmy, you said, and that all engagements, it's really important for us that all engagements begin with the housing problem conversation to determine need. So again, it's not a cookie cutter response. And I would say not just in program design for diversion and rapid exit, but at the front door, generally, housing problem solving conversations are important to determine family and friend history, extended network history, so that we get a really good understanding of the skills and strengths that households are coming into their experience with, so we can quickly and immediately end their housing crisis. So housing problem solving.
I will echo that. Housing problem solving is hugely important. Liz.
Just to add on that, and I'm sure this is true for lots of us, but having staff with lived experience is critical in connecting with people where they are. So for example, that program that works primarily with people having come home from prison, absolutely necessary that they have someone to connect with that understands trauma and all of the things that go with incarceration so that they can really connect to people from the start.
I think that's really important. And that actually leads me to my next question around what messaging do you all use for your rapid rehousing program? For providers, it's always about how are we selling the program? What pitches are we using? How are we talking about rapid rehousing to the panelists? I'm sorry, not panelists, to the participants, as well as the community, landlords, but what messaging are you all using?
I'll start with the landlord side. It's important as you build your relationships with landlords that there is a systematic approach around geography, obviously pricing, access, barriers. And one thing that folks don't realize is that when you walk in a leasing office, there's a different message for each person that you're going to encounter when you walk in that office. So the priority of the leasing manager is one thing. They're prioritizing ensuring that they're processing applications quickly, processing highly qualified individuals, because a lot of times there's incentives for them to lease up units. That's one conversation. But I also pay attention to the person who's collecting the checks, because I want to make sure that I have a good conversation with them about how these programs are going to help their bottom line. They're going to make sure that close out at the end of the month, you've got payments that are on time coming from our organization. A property manager, we have a host of case management components of this work that we're doing with rapid rehousing. And our case manager's job is to be present, do home visits, connect with the clients in the community where they live, work, and play. And you're going to see our case managers on property, ensuring that they're providing direct services to the individuals that you're serving. So I really try to ensure that we are speaking a different language, paying attention to when you walk in that leasing office. Generally, in the property manager's office, there's a board that shows all the vacancies that they have and if those units are actually leased up. So kind of take a look and see, so you can have an understanding if there's units that are pre-leased, if they still need appliances. A lot of times that's up in that office. So making sure you have that pitch for those direct individuals that are in a leasing office. And I think selling your program in a way that they understand that it's going to be just as or even better than if they were to lease to someone who was not connected to a social service program.
Just to add to that, I would say about 4 or 5 years ago, we joined the New York State Capital Region Apartment Association, which is interesting because we get emails and hear about webinars and events that aren't necessarily consumer friendly. However, by getting those emails and messages, we stay aware of the conversation they're having. So a lot of local landlords belong to that association. And it's a group of landlords advocating for things they want. Those things don't necessarily serve the people that we serve, but I think it's important, we think it's important to stay connected to that conversation so that we can respond to it if needed. That's been very helpful.
I always say I have my pocket pitch and I have my heartstrings pitch. So my pocket pitch is about dollars and cents, what we can pay when, if there's a problem with something, let me know, we can help. If we have somebody that's in a unit and it's not working out for whatever reason, we can help move them to somewhere else without you having to file an eviction. We can fill the unit again, so that there's no months of rent that go unpaid. My heartstrings pitch is all about, this is who we serve. This is why it's important. These are people who are living in your community. These are children who are going to school with your kids. And I give both, and then I see which way they seem to be more, which pitch they're more interested in, and then I give more information. But I would say for both sides, whether landlords are doing it because they genuinely care about helping or because they want to make money, talking about the services is super important. Everybody cares about that part. Jimmy, just like you said, Our case managers are going to be there. They're going to be present. If there's a problem, reach out to them. We do a lot of go-betweens so that we are delivering messages from landlords and property managers to clients about trash that's in the yard, or, just a dog that's barking or whatever. We could be that person. And when we show that we can do that, we have landlords that keep coming back.
So I'm curious, how do you all also describe rapid rehousing for the individuals that you're providing services to?
Yeah, we generally, when we first meet with people, we describe, the length of stay, what the goals are, and of course asking them what their goals are for the program. But I would say honestly that the bulk of people that we're working with, even prior to being in the rapid rehousing program, have already applied, of course, for housing through CE. So everyone that we're housing comes through coordinated entry. So even before we engage with that person, there's been a conversation about housing and what the basic needs are and the goals and the objectives. And that's helpful if you're working with coordinated entry. So by the time we get to the conversation and accept the referral, some of that's already been done. So we do a little bit more of that. And then we start searching for housing, of course. Where does this person want to live? What are their goals, objectives? Understandably, people don't want to live in certain parts of town for very good reason.
And Amber, I know you built some community backing and buy-in with your rapid rehousing.
Yeah, yes, I think I want to talk about messaging to the community from a systems level perspective.
Okay.
Because some of the market obstacles that Dave mentioned earlier, I think we heard, just a little bit of feedback from the community and like wavering faith in rapid rehousing. And we did a really deep dive into our data, and the reality of what we're seeing is that the vast majority of our systems inflow is experiencing homelessness for the first time and is a solid match for diversion, or it could be a potential match for diversion or rapid exit. And I think it was really important to message that to the community and just emphasize that could hugely alleviate pressure on the system and free up some of those more robust interventions like traditional rapid rehousing, PSH, for the households that need it the most. So, and it works. Our data is showing that it works.
That's such a great point. And you really sound like you also were able to scale up your program. So
Yes.
Can you all tell me how you've been able to scale up your programs in various ways, from financially as well as program design?
I can kick us off on that one, since it's kind of related.
Mhm.
Scaling funding was really important. We piloted diversion and rapid exit in our community with families. And so we had several years of data showing what percentage of the family inflow could successfully be diverted, and that the number of returns to homelessness were really minimal. And so our community decided to respond to the HUD unsheltered NOFO to request rapid rehousing dollars and creatively use them for this purpose. So that's how we were able to scale diversion and rapid exit system-wide.
Thank you. Go
I'm
ahead.
going to jump in. Let me pivot back to just the one point I wanted to make about the messaging and then I'm going to answer that question you just asked, Amber F. So one of the things when we were first initiating conversation with clients during that assessment phase, we train our team to get their perception first of what rapid rehousing means. A lot of times people come in the door and they have heard through the grapevine, I was told that you're going to pay my rent for 24 months and I'm not going to have to do anything, or all these things. So we like to gauge to see what their understanding of it is. And then the second part of that is, really finding out what they feel like the most important part of this engagement is. Because a lot of times what you'll hear people say is, oh, hands down, it's the rent assistance. And I totally disagree. That's the least important piece of rapid rehousing. The most important piece is actually the case management, because at some point, the rent assistance is going to go away. But all those nuggets that folks will take in from their engagement with their case manager, their engagement with the community that's going to help support them once the assistance ends, those things are going to be lasting things that's going to be embedded in how they move, how they operate, how they also navigate when there's obstacles or situations when there's not enough. And I think that that's what we need to continue to sell, is the importance of high level, holistic case management to ensure that when we do step away from the financial assistance, because it's not a money tree, it's going to end at some point, but those lasting things, engagement through case management will continue to remain and help that family be resilient the next time that they find themselves hitting some type of obstacle. I don't know if anybody wants to add to that, but I was going to keep moving on to your scaling up question, if you don't mind.
Nope, that's fine. I think I all set.
So the scaling up, I think it was important for us as an organization at the onset of this pandemic in the country. We recognized as an organization that the individuals that we were going to start seeing coming through our doors were going to have higher barriers. They're going to be have less income, and we had to make some changes internally to the standard way that people provide rapid rehousing, which is one person does everything from A to Z. You have one case manager that's looking for the housing, that's doing case management, that's requesting the checks from your finance department. And we decided to split that up and create specialist positions. So now we've created situations where you have a case manager that's doing just case management. There's a team of housing locators that are doing housing location for a cohort of the participants. And then you have a client assistance coordinator, which what we call it, that is processing all the rent checks on behalf of that particular client. And that really allows for that case manager to take a deeper dive and really focus on case management from day one, connecting the mainstream benefits, getting connected to workforce development and income. And then they're doing a warm handoff, literally. Once the assessment's done, they're gonna meet with the housing coordinator at the same time. And then that housing coordinator starts to work on the housing search plan. We intentionally bought a van. So we bought a 12-passenger van to help expedite people's ability to get us attached to housing units that were vacant, because we realized that we're giving folks a list of units, but by the time they went to go see the units were leased up. So we started introducing housing tours where we're gathering numerous of our clients, we're getting them on the van, and we're creating a look and lease type of environment. We're going to show you about 4 different properties. You'll get to see what the environment is, which one you like. By the time the end of the tour, the expectation, air quotes, is that you will fill out an application for one of those apartments that you just saw on the housing tour. So that's how we prepared for kind of scaling up. And then what we did in Atlanta was we used that model that we kind of built at PCCI, and then we took that to a system-wide model, because we recognized that there was a lot of money that was coming down through the federal government to stand up more rapid rehousing, but there wasn't the capacity within the community from an organization perspective to do rapid rehousing from soup to nuts. So we found that there were organizations that raised their hand to do case management, but they didn't want to do anything around the TFA, and they didn't want to do the housing location work. So we created a systematic approach where we had multiple organizations that are providing case management for these clients. We have one organization who is doing just the housing location services. And then we have another organization who is responsible, PCCI, for all of the administration of the financial assistance. So specifically in Atlanta, our Atlanta Continuum of Care Partners for Home, that is how we have responded as a community to scaling up rapid rehousing by sharing the work with multiple providers that already existed, but they just did not want to do rapid rehousing from soup to nuts.
I think that's great. I hope people are taking some notes out there. I think that that's great. And like you said, we have to think outside of the box and do some things differently because times are not the same. So how does innovation in partnerships really assist the other programs that you all have? I'm sorry, we heard from Jimmy, but Melissa, I know that you have some strong partnerships in your program as well.
Absolutely. And pretty simply in terms of scaling up, we say yes. When the community comes to us, when a partner, when a funder comes to us and says, hey, we're thinking of doing this new thing. Do you guys want in? We say yes, every time. If it's in our wheelhouse, we feel strongly that we should be doing it. We hire great staff. We do good work. And so we say yes, we make it happen. Our UFA, our Unified Funding Agency is our COC lead. They said, what do you think about doing a rapid rehousing program specifically for people who have been in shelter multiple times and who have been through our other rapid rehousing programs before, and for whatever reason, it hasn't worked out? We said yes. The program was highly successful and we're in our 4th year of it now. When our local community college got together with a couple of other partners and said, hey, we really need to find a housing partner that could work, do some work for our housing unstable and homeless students who are trying to get degrees. And we were brought to the table and said, do you want in? We said, yes, absolutely. We've been doing that program for 4 years now. That branched off into another program to say, hey, if we have people who are trying to get CDLs or IT certifications or whatever, but you know, they're either working a job where they don't have the time to do these certifications, or they're stuck, you know, they're in shelter or they're between places or whatever. And they really need somebody to help them pay rent and do case management while they're completing programs. You guys went in? Yes, absolutely. We've been doing that program for 3 years now. So I think that we also had a pregnancy pilot where we were challenged to serve 150 pregnant women in a 2-year period and get them all into housing and try to help increase birth outcomes. We said yes. We took that on too. We hired 10 case managers in about 3 months and we said go. So I think when you do good work in your community and you're passionate about what you do and you know that you have the ability to train staff and to get everybody on the same page and make it happen and be really good advocates for clients, people will ask you to do things and you have to be prepared to say yes. And then you come through, you follow through with what you promise, right? Promise is not always going to be success necessarily. We're never going to promise that every client is going to be successful. We're going to promise, though, that we're going to work as hard as we can. We're going to do every single thing that we think that we can do for each person on an individual basis to try to make it happen. And if the end result isn't exactly what we want it to be, we're going to say, we came up with a plan. Everybody did their part, right? And we tell every client when they leave us, if you need us again, come back, because the door is always open and we'll try something else. If that didn't work, we can try something else.
Great. Liz, do you have anything to add to that?
That would be really hard to follow. That's amazing, Melissa. Thank you so much. Well, just the enthusiasm, I can feel it. And you know, all of us have been through COVID, and I was just speaking with a colleague a little bit before this session, talking about some of the harder things that we're seeing now, mostly related to drug use. And I know some of our staff members, and I'm sure other people, of course, on the call have experienced this really drastic increase. And what can we do to keep that enthusiasm going as program leaders and team leaders and just, you know, housing navigators, making sure that we're still meeting people where they are, still saying yes, really supporting people that work within our programs. Rapid rehousing can be different, of course, from PSH and other housing program types. And I always explain it to people like this, just because I'm married to a nurse, but nurses that work in the ED room often aren't the type that you see working in med surg. That longer term type of activity rapid rehousing is just that. It's fast, it's furious, it can be very exciting. I love rapid rehousing. If I had been a nurse, I would definitely want to be in the ED room and not in longer term situations. It does take both. So I'm often not just selling this to participants, but to people working within the program. What's great about working within rapid rehousing? It can be super intense, like programs working with people when they come home from prison. That's different than some other type of rapid rehousing programs that want to see some history of employment. And people have to understand the trauma and everything else that can be associated, of course, with incarceration. So we absolutely want someone that's walked that trail and can tell that story and can sit with someone. So in terms of selling rapid rehousing, it's not only to program participants, but it's all about the staff, all about, I don't like the term case management because people aren't cases and we don't manage them. We walk side by side with them. I often describe us as kind of human GPS systems. You tell us where you want to go, and we will together look at some routes. And if one doesn't work out for you, that's okay. Your GPS system doesn't make you feel bad about turning down a different road than you had originally planned. It just says rerouting. And you don't feel shame just because that happens. And I think that's important with rapid rehousing or any type of housing, that people have to decide for themselves what they want, and then we're walking beside them to try and achieve those outcomes. And if we don't, that's okay. We just come up with another plan.
I love that analogy. I have to remember that. I love that analogy. But yeah, it is their plan. We are there to assist. It is a partnership. And it's team work effort in order to work with someone. So sorry, I lost my place. Right now, because we know the times have changed, right? You all are really scaling up your programs. You're really doing some things differently. You're really thinking outside of the box. You're really being creative with your funding as well as your program design. But if it were up to you, how would you say that you would change how rapid rehousing is funded so that it can be even more effective? I can tell, Jimmy, you have something to say on that one.
You know I do. So thank you, Liz, for that. You know, I think it's important. Words mean everything, and you're right indeed that case management title is not appropriate, and providing that support and those supportive services, I think, is definitely an important way to continue this work. Rapid rehousing, one of the challenges that I continue to see with the provision of rapid rehousing as it relates to funding is that there are other federal organizations, entities that have stripped down a lot of the barriers to administering the program. Rapid rehousing probably has not been reauthorized since it was created in, I don't know what year it was created. It was probably around that HPRP time when it officially was created. But there's a lot of things that it can and cannot do. And I think it's time for us to really look at how we can push the needle and get some changes as it relates to what it can pay for. For example, you know, there's certain circumstances where you cannot pay for a person's utility payments unless it's tied into the rent payment as one. There's things around transportation that have to be very specific as far as giving bus passes, and it has to be given for particular purposes, and it can't be used for different other things. So I think it's time for us to look outside of the box and really push some legislation or policy to help us gain better usage for the funds that are less restricted. An example of that, and I think I saw something mentioned the VA in the chat, but the VA SSVF program, there's no walls or no guardrails on that program for the most part. You know, it pays for everything that the veteran needs in order to expedite their homelessness experience, from homelessness to house. And I feel like we are in a time that we need to really look at the regs and push to get some adjustments to allow for us as practitioners to meet clients where they're at and provide them the holistic services that are needed in order to ensure that their homelessness is rare, brief, and only one time.
I would say that for us, it's all about diversifying funding. So I agree that we need to keep pushing state and federal funds to give us what we need. But until then, we're going to ask other people. We're going to ask anybody who wants to give us anything, and whatever contribution they can make, we're going to use it how we can. So our goal at any time is to have several pots of funds that we can use to do whatever we want, all within the same program, right? So this private funder wants to give pots and pans and buy furniture. This funder wants to, pay application fees or whatever. So whatever money people want to give us, we cobble it together and make it happen. We have plenty of people who won't give money, but they give items. Fine, you want to buy us new pots and pans and give us those? Great, we can store those, right? Like, and we won't just take anything. We're picky. People need to have new things. We're not, giving out used pots and pans. We want new ones. But there are plenty of people out there who are willing to help, and we're going to let people help however they can. And we're going to continue to push people to say, it's not a matter of whether or not you're going to help us. You should be helping us if you live in this community. So in what way can you contribute? What is your contribution going to be? Not everybody's going to give us $100,000, but we have a whole donor base that just did a Mother's Day event for us. So we had all of our moms pick 3 things off a list that they really wanted or needed. Some of those things were like blenders, vacuums, pots and pans. Some of them were gym memberships, TVs, things like that, other things that a household should want and have. And we had people come out of the woodwork to support that effort. So everybody has a place here. Everybody can contribute in some way to making this happen, no matter how big or small that is.
I love that idea, because a lot of times when we're thinking about funding as programs, it needs to come from a grant, it needs to come from HUD, but putting responsibility back on the community to say, hey, you can support us in this way. You can donate so that people can have furniture and whatever in their household, right? Because we don't just want to house someone, but really make it a home for them. And everyone can contribute. I love that idea for the community to be involved in helping as well. So what ways of, I'm sorry, was someone gonna jump in?
Amber, I was only going to say that I 100% echo what both Jimmy, you and Melissa said. Diversion really relies on creative housing problem solving. So with the restrictions that come along with the rapid rehousing funding, it limits our ability to truly be creative. So we've had to already tap into, to Melissa's point, other pots of funding, like we call it a flex fund, a flexible pot of funding to fill in some of those gaps that we just can't hit with the rapid rehousing funding. So I agree with Jimmy.
Right, and flex funds are huge for not just rental assistance, security deposit, but also furniture, clothing, just all of those areas that are not covered.
And as Amber Freeman said, I think the idea of using the fundamental structure of rapid rehousing to create non-government funded programs is a way to mitigate some of these things that we may be feeling if we're heavily dependent upon federal dollars, right? So we have looked and sought out private philanthropy with the bones of a traditional rapid rehousing project that is then focused on a subpopulation, generally for us, families with children that don't necessarily, and hopefully I'm not getting into another question, score high enough on our vulnerability index score to be prioritized at the top of the list to get into a program. So I think that's how we can be more creative in utilizing the core components, but using that core component to write another application for a philanthropic ask that allows for you to serve a subpopulation that otherwise would not make it to the top of your coordinated entry system.
That's a great point. Great point. So what ways of addressing racial and other equity issues do you all utilize in your programs?
So for us, it starts at home. We make sure that our staff are all trained and that they know not only the history, but what's currently going on. And the fact that people are still experiencing differences depending on, what you look like. Your experience is going to be different for sure. We looked at our board. We said our board needs to be more diverse. We need to call that out for sure. We have lots of older white men on our board, as almost everyone does. And we said there need to be more women. There need to be, a more diverse racial population on our board. So we've actively gone after that and told our board that they needed to be recruiting that way as well. We ask for feedback from our clients every chance that we can get about their experience, both before, during, and after being in our program. And if there are ways that we can help, we want to know about it. And I think we push to, anytime we're being trained, we're saying, hey, we need to be trained more. Like, we know that disparities exist. So what is our part in that, right? Like, we know that our population in the shelter is much, much higher for people of color. So that means that there are going to be more people of color coming into our program. But once they are with us, then what are we supposed to be doing, right? Like, how are we making it so that people are not coming back to us again a second or third time? I think it's about being honest with yourself and about being able to hear the things that people are telling you about what they are and aren't getting from your services, and then adjusting accordingly.
Yeah, so I would very much echo that and just add that we've looked at things program by program. So, for example, within our PSH programs, just over 60% of the people we serve come from a more diverse community, but within our prison reentry program and the rapid rehousing program that goes along with that, it's much higher. It's 90+% of the program participants. So seeing that also in staffing, making sure that that's one way that we do this. On the board level, that's been a hard one, honestly. As the executive director, of course, that's part of my job, a big part of my job, working with the board, etc. Would love to hear eventually from others of how they're making that happen. We're making progress in that direction. But on the staffing level, I would say I'm very pleased that we've been able to really diversify the staff. And it's not just, as we know, about race and ethnicity and those things, which maybe I might gently say a little more obvious. But for example, having staff that have lived that experience, whether it's homelessness, hunger, incarceration, addiction, people that have really walked firsthand, that kind of equity and equality is critical.
Right. People need to be able to see themselves in a way or feel as though they can build rapport. But Liz, even with just the population that you serve, with your reentry work, that is addressing equity, right? Because unfortunately, we do know that our criminal system has Black and brown folks at a higher rate. And a lot of those individuals, unfortunately, end up in homelessness. But you all have designated funds so that you can assist them with being rehoused after incarceration. So that within itself is addressing equity.
True.
I'll touch on the equity question real quick.
Okay.
So I think we have to look at equity from multiple lenses. Hopefully I'm not taking any of Amber's thoughts. because I saw you came up at the same time, at multiple lenses. So you got to look at it from a system level, right? We have to make sure that we are looking at equity from a system level, making sure that people have equitable access to even being acknowledged by the system or the providers to enter into these programs that we're talking about. Liz and I think Melissa also talked about from an organization perspective. Do you have an equitable representation of the individuals that you serve through lived experience, through other means of equitable access or equitable individuals as a part of your team? So I think those are two things that we pay attention to very closely. We also ensure that as a part of our provision of social services, I'm moving away from the case management, the provision of social services, we are in the field a lot. And being in the field allows for you to be able to connect to the communities of which the people that we serve live, work, and play, right? So if we're asking people to do certain things or have a certain look within their apartment, but yet they've got to walk a quarter mile, catch a bus, and drag their groceries from the grocery store in the rain with no umbrella, then the reality of what we're asking them to do doesn't even make sense. So being in the community and actually walking the life of the people that we serve, I think is important for us to understand where the gaps are in the equity of our programs and our service delivery.
Absolutely. And Amber, you had something to add to that?
Yeah, I think that was great. I think I also wanted to say that, just emphasize that nationally and locally in most cities, but definitely here in Dallas, Black households are grossly overrepresented in the homeless population. And so our community collectively has done a lot of work to make sure that folks with lived experience who are representative of the population are actively engaged in and leading our systems work groups in all lines of work, including rapid rehousing and diversion, and that they're engaged actively and intentionally in all stages of the process. So that's system design, program design, the creation of measures and strategies to impact measures to improve racial equity outcomes has all been important. And I want to give an example. In planning for the system-wide implementation of diversion, one of the members of our lived experience coalition highlighted a gap in access in our system in South Dallas, which is a region of Dallas that is predominantly Black. And we didn't have enough system access points there. So as a part of our RFP process, we weighted agencies responding in underrepresented geographies. So that person's involvement was pivotal for the design of our program.
I love that you say they should be involved in every single aspect, right? From program design to program delivery to surveys after to everything. And this is completely off topic, but because too often we can tokenize people, right? And just have them in certain spaces, certain meetings when we want that feedback, but really should be a part of everything from beginning to end.
Amber, can I add one more?
Yes,
thought on
Amber.
that? Thank you. I just wanted to add also that this is from a system level perspective, but you can also do this at the agency level. We've also done some very intentional work in disaggregating data by race and ethnicity at each system touch point. So that is who's experiencing homelessness, who is enrolled in the housing wait list, who's referred to each intervention type, and who's staying in case management the longest in that intervention type, and who is returning to homelessness in that intervention type. So I think those are really important things that can be implemented at any level of the system.
I think so, because that actually brings me to my next question about how are you all leveraging data? How are you letting data kind of guide your program or listening to the story that your data is telling you. So Liz, you started with some reentry and homeless data.
Yeah, so that's a great question. Thank you. When we started working with our county to provide reentry services as a housing services provider, one of my first questions was, well, how many people coming home from prison are homeless? And there was no data. And it still surprises me. I mean, honestly, but then maybe not, because I'm not sure anybody wanted to know. So we didn't use HMIS. We just kept it super simple. And every time we did an intake, we just said, where did you sleep last night? And of course, people describe places different ways. Oh, I was at the Mission, or I was at 259 South Pearl. Well, that's the same place. So we just put it all in a grid, sorted it, and it surprised all of us, well north of 30%. And then we started doing that once a quarter, and we found it could be north of 50%. So how do you just come home and you're homeless? So we stopped saying, people aren't coming home. That's not a home. If they're sleeping in a shelter, that's not a home. So stop saying people came home. If they're homeless, they got released from an institution, but they haven't come home yet. And so that data helped us advocate with our COC. It's also a UFA. And we were able to apply for a reallocation of funding in order to start a program, a rapid rehousing program, specifically for people that have come home from that setting. And that's important because if you're working within CE, coordinated entry, people that have been in that setting for more than 90 days often fall kind of to the bottom of the list, right? Because they're not chronically homeless. And so they can languish on CE lists for a really long time. So by creating a program more specific to them, we were able to bypass needing to be chronically homeless. So that's been very successful, honestly.
That's great. That's great. Being data driven and really letting the data tell you what work needs to take place.
We've looked at data in some of our pregnancy work. We knew that we wanted to impact birth outcomes, that we wanted to show that housing impacts birth outcomes. And so when we were setting the stage for our really large program and said, are we going to limit what trimester people come in? We said, no, we're going to take everybody because we felt like it was the right thing to do, which I still believe that it was, right? Even if somebody is 2 days before having a baby, we still wanted to work on housing with them. But we found that the only way we're impacting birth outcomes is if they're in the first trimester or possibly like the first half of the second trimester. And so we said, we're getting people too late. We need to find ways to get to people sooner. And then we also better have housing ready when they come to us, available for them to go into. Columbus is a very fast growing city. We are seeing much longer lengths of stay in shelter all the time. So if we have a very small window where we're going to make an impact here, then we need to figure out how to do that. So we are now working towards developing a housing project specifically for pregnant women so that we can immediately get somebody into stable housing as soon as we identify that they're pregnant and housing unstable.
That's great. And as someone just put in the chat, yes, the data does not lie. So that's great. We had so many, nope, go ahead, Jimmy.
Just one quick thing. So, Melissa was talking about some of those other things that kind of make a house a home that generally are big asks or asks from the community to fill in the gaps. We're CARF accredited. So a part of our CARF accreditation is that we're serving our participants, those that we serve in our program, and more so on the qualitative side, right? We're looking at, how they feel and the things that we've provided or we're not providing that can make their lives and their stressors a lot less. So we're using that information to then guide us on where we can make adjustments in our program and fill gaps that are going to provide a more holistic service provision to the individuals that we serve. So we also have looked at adding a research component to some of our rapid rehousing work, where we're pulling in a third party body of research, mainly through universities, to provide a study on both the qualitative and the quantitative side of our programs, based on a comparison group and a comparison group. So I think that's something that we're trying to look at leveraging more, is data to allow for us to have a bigger ask, reach to those corporate foundations, and generate income that is more of a public and private partnership, as we discussed earlier in the panel.
Great. I commend all of you all for the work that you all are doing. And data is not an easy thing, but we have to do it. We have to do it to really see what's going on. Data, as well as qualitative data, and really hearing the stories from people. So we had a lot of questions coming in. I know people had their hands up. I know people put questions in the chat. So I want to have some time to start getting to those questions. I'm going to start with Melissa. So there's a question they're asking about, let's see, your individual rapid rehousing support. What does that look like? How do you provide individualized approaches to rapid rehousing funds within funding restraints and obligations?
Sure, absolutely. I mean, I would say that funding can dictate what you do as a whole, but doesn't dictate a conversation with a person. Funding can dictate that you have to have a goal plan. Funding doesn't dictate what the goal plan says or what you work with on that participant to do that goal plan, right? So when we meet a person to do an intake, we're of course asking all the questions that our funders require us to ask, but we're also working on building relationship and digging a little deeper. We asked, none of our case managers have more than 15 families on their caseload. That's a max for us. And if we're looking at unhoused, it's about half that. So if all of your participants are unhoused, you're holding a maximum of 7 or 8 cases at one time. We know that if you have more than that, you're just not going to be able to provide the services that you need to. We ask everybody to have at least weekly contact. Doesn't always have to be face-to-face. We're living in a technological age where there's lots of texting and calling going on, as well as, Zoom meetings can happen sometimes too, but that you're at least touching base with people every week. Often that's many times per week, but at least once a week to see what's going on and making sure that the family's okay. And then I said, it's basic people skills and advocacy, right? We are dealing with people who have been screwed over by other systems numerous times, people who have experienced unbelievable amounts of trauma. And so the very first thing that you have to do is make sure that they trust you and that you follow through with whatever it is that you're telling them that you're going to do. We work with people even when they disappear on us for periods of time, right? Like, we are not going to close your case if we don't hear from you. We're going to keep fighting, and we're going to look for you, and we're going to go out, and we're going to leave letters places, and we're going to talk to people that might know where you are, because we feel like it's important, because it's not about the timeline of the program. If we have to take a ding from the funder, we take a ding. It is what it is, right? The people are more important, and trying to achieve something for that family is way more important than anything else. And we have pushed back with our funders numerous times to say lengths of stay aren't appropriate here. We're not going to be able to get people through. All we're doing is pushing them out into things that they don't want and can't afford, and they're going to come right back. And so during COVID, we took a stand and said, no, we're keeping people open. We're going to pay rent for longer. We're going to make sure that they have something happening. We're not just going to close people based on some arbitrary number. And our funders said, yeah, you're right. And now our whole system has kind of changed. So you do right by people first. You do right by the people that work for you, and then the people that you serve also, because that's important too. If you have a case manager that says, hey, I'm really overwhelmed, I can't take any more people right now, then you honor that. And you try to meet them where they are too. I think that's something we don't talk about enough, is how we take care of the staff. We have to listen when people are saying, hey, I've got some really hard cases. I need to have some time off, or, I need to be able to focus on the couple of people that I already have. So we do that. And I think when you do that, when you stand up for the right things for people, then good things will happen.
I think that's amazing. And the fact that you all are able to keep your caseloads down to such a small number means you're able to really provide that hands-on, I was going to say case management, but Liz, we're not using that term anymore. What's the new term?
Housing navigators is
Okay.
what
You're able to provide that hands-on housing navigation services to individuals. So I think that is great. What services or challenges do you see that people need the most, where there's truly gaps in our system?
Is this just for me? Is this for everybody?
Anyone.
Okay.
Yeah, several people referenced things that can't be paid for through COC funds per se, or some traditional grant opportunity. Everything that anyone here on this webinar needs, so go the needs of the people that we're seeking to serve. So it's, everything that you need in a house has been said here, right? Pots and pans, utensils. People may often be starting from scratch, regardless of where they're coming from. If it's a domestic violence situation, you don't flee at 2 a.m. with your dresser on your back. So you need furniture, you need everything that a home or house requires, bus passes, transportation. I mean, thousands of dollars in bus passes we give out, every year. That's all privately funded. So anything, clothing, food, etc., all those basics. And it's good. It's absolutely necessary to find innovative ways to pay for them. But I do wish that some of those more traditional funding streams did open up and help entities pay for some of these things. Not every entity has the capacity or opportunity to spend time with the community, helping them understand why it's important to support these programs. That can be hard for full-time people already doing some great work. And I would love, boy, a caseload. See, it happens to all of us. But working with 7, 8, 9 people at a time, that's amazing. I mean, I would love to replicate that. We're running 17, 18. The majority of those unsheltered. I'd love to get down to those numbers or closer. And maybe that's a goal. Like if that could be 13, that would be great. And that would be a good way for us to, be able to engage more. Staff are tired. And I think that's true all across the country, of course.
I saw you unmuted, Amber.
Yeah, I think that two of the biggest game changers that our system supports, that I've seen decrease the overall length of time for people experiencing homelessness in our system, and this is supported by the quantitative data that we look at the system level, but also the qualitative data that we hear from case managers in our case manager roundtable feedback sessions, are housing navigators who are dedicated to finding units. I think, Jimmy, you talked about this a bit earlier, and a dedicated landlord engagement team to kind of create a portfolio of mostly vetted units and talk about the rapid rehousing programs and the different interventions and how the households in our system are actually beneficial to landlords. I think there's like a misconception that the households that we serve are liabilities and risks. But if you look at just the plethora of services that come from our system to support a household, it's hugely beneficial to work with somebody experiencing homelessness, and that comes from our system and it comes from our programs. You know, there are annoying tenants every day, and how many of them come with housing case management and a team of support? So.
Great point. So with that, and questions are coming in, I'm going to try to ask them a little faster. So with the model of rapid rehousing, right? First, we house someone, housing first, Maslow's hierarchy of needs. Housing is right there, basic needs. And then they will hopefully begin to work on other things, employment, going to the doctor, social skills, whatever it may be. How do you all motivate individuals that you're providing service to really have the opportunity to increase their income and stability?
I would say that we start by doing a goal plan. And we have some pretty specific action steps in there, but it's not just action steps for the person, it's action steps for the worker too, right? So by the time I see you next week, you're agreeing to do these things, I'm agreeing to do these things, right? So of course, the next week comes, sometimes some things don't happen, right? I mean, that's natural. Sometimes people get busy. Another week goes by, then we go, okay, let's have a real conversation here. Are these the things that you really want to be working on right now? Or do you have the capacity to work on these specific things right now? If not, let's throw these out and start new ones, right? Because us just saying, why aren't you doing this? Why aren't you doing this? It isn't working. But we also look at like, okay, you said that you were going to go get your birth certificate between now and the next time that we met. I asked you if you wanted me to take you. You said no. So-and-so was going to give you a ride. Next time I come in, it didn't happen. Now I'm saying, hey, maybe I can take you. Or, hey, maybe I can give you a bus pass, or, hey, maybe I can give you a gas card or something, right? So you're breaking down every single barrier to the reason why people aren't maybe completing some of the things that they're doing, and saying, okay, well, we tried it this way. You said you wanted to do it that way. That didn't work. Do you want to try a different way? Because we have some other options here. And letting people know that they have choices, they can make their own choices. We are not arbitrarily pushing people into $12 an hour jobs. We know that's not going to do anything. You're not going to pay your rent with a $12 an hour job. So you're going to spend all of your time working that job, be able to spend no time doing anything else, and you're still not going to be able to pay your rent. So we're being honest with ourselves about that, right? Just getting a job, any job, is not going to be enough. You're going to come right back, and you're going to be working full time and still not be able to have a place to live. So people have to be in charge of that. We recently supported somebody through going to esthetician training. We were like, sure, we're going to keep paying your rent while you do this, because there's a legit job at the end of this, right? This is a goal that you've had for a long time, something that you've wanted to do for the last like 5-7 years and haven't been able to. Guess what? Now we can. She graduates next month, and she's actually going to move out of state and go somewhere else. And she has family there. And so that's going to work for her, right? But that plan that she has isn't the same as somebody else's. And that might not have ever happened if we didn't give her the time and the space to figure out that that was what worked best for her.
I think that's great. You said so many great things that I wish we had more time to really jump on. But I'm going to ask Amber, you said that there's so many benefits for landlords to working with individual in the rapid rehousing program. Can you give a rundown on what some of those benefits are? And then we do have some questions where people are really asking, like, how do you convince landlords? How do you get the buy-in from them on the benefits of the program?
Yeah, sure. The benefits of working with somebody in one of the rapid rehousing programs, there are plenty. One, we've already talked about the case management support. That's pivotal. I think I'll go down the list first. So case management support, behavioral health support, being able to tap into, at least for our community, the flexible pot of funding, your general tenant wouldn't have access to any of these things. So if your general tenant has hit a hard time, they don't have agency support to fall back on. And it's not even necessarily always about funding, but having a third party to go to and for the landlord to talk about some of their grievances, being the case manager, often helps. A human helping navigate those conversations is really impactful. I missed the second part of your question, Amber. I'm sorry.
You're pretty much on one topic. Just how do you convince a landlord? How do you get the buy-in from the landlords? So I think you answer that. I'm going to hand it back over to Dee. We have so many questions and we were able to cover some, but thank you all so much for this discussion. And hopefully one day we'll be able to continue it.
Yeah, thank you all for a great discussion. And thank you, Amber, for being our fearless leader for the day. So I'm just gonna do a little bit of a wrap up at the end here. Just to take us through a little bit of what was discussed, although I can't make all of the excellent points again that you all shared. And thank you so much for doing that. But the key thing we want y'all to walk away from this with is that rapid rehousing works. It's a really, really important part of a system. It's not the only thing that your system needs, but it works, it's flexible. And so it can serve a lot of different types of people, different types of households in different communities across the country. It moves people to housing quickly. Most people who get this type of assistance do stabilize in housing and do exit to permanent housing. And we can serve more people overall if we can move people into housing quickly and through and out of our system and help them stabilize. So it's just a really key part of an effective homeless response system. And there are lots of creative ways to do it. You've heard some of those today. I encourage y'all to continue the conversation. I was very excited to kind of see the discussion in the chat and hear all of your great questions, because those are the right questions and we're all continually learning, and I'm just so glad that you're here learning alongside us. A couple other things, and I didn't capture everything on here because this was a wide-ranging conversation, but a couple of the innovations that I wanted to highlight at the end of this, just the first thing is starting with the belief that people can make it. I heard every single one of our panelists mention something along these lines, which is like, we have to go in standing alongside people and not writing their story for them and deciding that they can't or that it's not going to work. We have to believe in them, and we have to believe in this intervention, and we have to meet people where they are to make it work. A couple of other innovations that I heard y'all talk about, and again, this isn't everything, so I'll just highlight a few of them, but consolidating some of the admin functions, letting individual staff and also individual organizations or programs lean into what their strengths are and working together. So I heard Jimmy, you talk about taking on the admin and letting other programs just not do that part, because that's not what they were great at, but they still do great case management and support services. And for a lot of smaller communities and smaller organizations, that's going to be key to getting this intervention into communities that otherwise just might not have the bandwidth and the admin to manage HUD grants or some of the kind of ins and outs of programs like this. So that's a really important innovation coming out of the field. Employing people with lived experience as staff in your programs, because they understand this process better than anyone, and they also are gonna have creative solutions that you're not gonna get from staff who don't have that experience. They're also gonna be able to build rapport in ways that just are not possible when you haven't lived through it. So that's really, really important. Supporting and encouraging shared housing as a viable option when affordability is an issue. We had a lot of questions come up both in the chat and on the Q&A about supporting folks with fixed income or limited income. And we know there's an affordable housing crisis in every community in this country. It used to just be in certain places. It's now everywhere. And I think sometimes we do a disservice by deciding for someone that shared housing is a lesser option. And for some people, that's going to be the way to have an affordable and stable housing circumstance. And we need to take the stigma out of it. We need to say, you know what, if this is going to work for you, we support it. And we need to also shift our programs and policies to meet that, right? There are a lot of rapid rehousing programs that are not allowing shared housing when HUD says you can do it, your grantors say that your funders say that you can do it. We need to get on board with that as a solution, not pushing folks into it if that's not what they need, but also not stigmatizing it or driving people away from it when it's what's going to work. I also heard a lot of conversation about creative partnerships, both for services, providing services that are going to meet the diverse needs of clients across your programs, and also to grow resources, to build a bigger table, to bring more money in, and grow programming, because we know there's not enough beds in any program across the country to meet the need. And that's why we're seeing rising numbers of people experiencing homelessness. Effective landlord engagement, lasting relationships with landlords, and really building on those successes, and using your data, paying attention to what's happening, because the data doesn't lie. And we had people in the chat saying it, we had our panelists talking about it. If you want to have positive outcomes from your programs, and if you want to also have equitable outcomes, you have to be looking at how your programs are functioning. And that means looking at the outcomes they're producing. The data will tell you where those disparities are, where those inequities are. And data may start with the numbers, but stories are also data. Qualitative data is important. Listening to people to understand why you're getting the results that you are, why there are disparate outcomes and inequities, can teach you a lot about what you need to do differently in your program and as a system to have more equitable outcomes. I want to make one final plug before I let you all go. We have a rapid rehousing course on our online learning center, and we are offering a discount to anyone who attended this webinar to take this course. We had a lot of folks asking about training resources. This is an excellent introduction for new case managers, or it's a great refresher for folks who've been doing it a while. It's great for managers. There's some tools in there for how to effectively manage rapid rehousing programming. So really just want to plug that as a resource for you, and know that it's half price to you if you attended this session. I want to thank all of our presenters today. Thank you so much for being here. Your wisdom and knowledge is so useful to everyone across the country, and I just really appreciate your time and your energies and your willingness to share so openly about your programming. Thank you, Amber, for moderating this session, for keeping the conversation moving, and bringing the conversation together. And if you have any questions about the series as a whole, please reach out to my colleague, Josh Johnson. His email addresses will be available on the slides. And please do join us for future sessions. We have some exciting content coming up in the coming months. Thank you all so much. Have a great rest of your Thursday.